Okay, I'd like to get started. My name is Peggy Murray. I direct the Global Alcohol Research Program at the National Institute on Alcohol Abuse and Alcoholism, which is one of the 27 institutes and centers that make up the National Institutes of Health in the United States. I'm always happy to say that we have a separate institute at NIH that studies alcohol and the problems and as well as the health benefits. Because it's an important problem in the United States. We're different from other drugs. It's a legal commodity. Most people can use alcohol responsibly without experiencing harmful effects, and that's an important part of the Institute and its mission. Reducing the harmful use of alcohol relates to violence in an important way. NIAAA has been a supporter of the forum since the very beginning, and I've been a member of the forum since the beginning. Alcohol has come up at every single workshop. It's been mentioned in all of the 9 reports. It's integrated with violence in such a way that we haven't had to have a separate workshop on alcohol because it's part of all of them. But I think it's important to point out that the relationship of alcohol use and violence is complex. And I'm just going to say very briefly a little bit about it because it's much more nuanced and complicated than this. But I thought I'd bring up some important points to remember as you listen to the talk that you're going to hear about alcohol and firearms. Alcohol is in of itself, it rarely causes aggression directly. And there's a myth out there that a lot of people think it does. Or it gives them permission to be aggressive. So I think it's important to start off with that. But victims are drinking or have drunk alcohol at the time of a violent event. So it's part of the victim piece of violence. Alcohol disinhibits normal control of impulsive behavior. By impairing information processing, alcohol can also lead a person to misjudge social cues, thereby overreacting to a perceived threat. Simultaneously, a narrowing of attention may lead to an inaccurate assessment of the future risks of acting on an immediate violent impulse. And finally, alcohol misuse can be a consequence or a coping mechanism of victimization or of having observed a violent event. I just want to point out, whoops, okay. I want to talk just a little bit about this because I think it colors this sort of myth about how alcohol causes or doesn't cause violence. But there are a small group of people who carry a gene variant that when they drink alcohol do extremely violent things. And this is a study by David Goldman. It was in Nature in 2010. He worked together with researchers in France and in Finland to study a group of people who were in prison for having committed a violent crime. These people, these carriers of this variant, they had committed the crimes, they were all male and they were all violent only while drunk from alcohol. So this is where the myth comes from. It is real, but it's in such a very small portion of the population that and of course these are violent crimes. These people are often on death row or in prison for life for their violent crimes. The crimes themselves are very spontaneous and purposeless. And in this case, alcohol is the cause, along with being a carrier of that gene variant. So this is where the myth comes from. And I have to point out that it's real, but it's also not all of us. It's also not most of us. And it's also not where the public health focus needs to be. So I'm bringing that up just to sort of start off. All right, that's all I'm going to say overall about alcohol and violence. Charles Brannis is a professor of epidemiology at the University of Pennsylvania, and he is the person who was tasked with writing this paper at the request of the CDC Foundation. I have to say that I learned a great deal from it, so I'm looking forward to having him share that with you.